thank you very much to everybody who has taken the time to come today. You're very welcome to this morning's session, and this is part of our HCI webinar series. My name is Oonagh Gilvarry, and I am the Chief Research Officer in HCI. And today we're going to be taking a little bit of time out and looking at the HIQA inspection findings to date that we have for the IPAS Centres. And I'm going to be presenting the data to you really to try and identify, I suppose, HIQA's key areas of concern or focus that have come to light to date. And then hopefully you're going to be able to use that information then to really make decisions regarding your resources and your focus and your activities as you move forward in your journey towards compliance. So hopefully it will be of value to you all. Just briefly before we begin, just a quick introduction, I suppose, to HCI. We help providers of health and social care services to make intelligence-driven decisions to attain, manage and improve quality, safety and regulatory compliance. And I suppose we do this by streamlining, supporting and transforming service and making sure that we have a focus on the provision of safe, quality care for residents. We're over 19 years in business now and have almost 30 members of staff, and we've supported in excess of 600 healthcare organisations, health and social care services, to achieve compliance in that regard. Just before we start looking at the data and the tables, I just wanted to have a quick recap on the IPAS regulatory framework. I'm sure you're all very aware of this, the model and how it has rolled out. But I suppose that in the centre, the Irish legislation, the SI 649 of 23, that was the legislation that was incorporated to give HIQA their authority to inspect within the IPAS centres. So that bedded in behind the national standards that were released prior to that. And then you have HIQA released the guidance and self-assessment documents first in 23 and released an update again in 24, just to illustrate how they were going to approach the inspection process. And it's important to note, obviously, we have the IPAS policies there and also the national policies that are applicable within the service, such as the safeguarding policies and the consent policies. So as I said, those HIQA guidance documentation is kind of rubber stamping how HIQA are going to approach the inspection process. And it really looks, and I suppose their presentation is a shift in that service provision from the one previously, which was the, providing your food and accommodation, to a much more person-centered and rights-based approach, which is also aligned to the national standards. And all of the HIQA standards that they have developed are very, very much based on the rights-based principles. And although they didn't develop the national standards specifically, they are putting their approach very much in line with that rights-based approach. We know when HIQA come on site, they have a very particular model that they apply. It is there's a triangulation approach where they observe the processes being implemented. They communicate not just with senior management, they want to get out and speak to frontline staff and also get the feedback and information from residents that are within the services. And then they're looking for the documentation and evidence to support the provision of those services to ensure quality and safe care. As we often say, if it's not documented, if it's not written down, it didn't happen. And they're certainly looking for evidence in that regard to ensure that we can get that information, utilize it, and then bring it back to drive continuous improvement processes within the services. Okay, so what are the findings so far? Well, just before we look at the graph and it'll provide us with some information in that regard, we know that there are 3 levels of judgment descriptors. So we've got compliant, where we all want to try and be, so meeting all of the requirements of the national standard. Then we have substantially compliant, where obviously there's been good work done, but some action is required just to bring it up to the higher level. Then into partially compliant, so they recognize that there are deficiencies at this stage, but that they don't currently believe that there is a significant risk to the residents. But if that action isn't taken, that could arise in the short to medium term. So they really are looking for action in that regard. And then not compliant, so that obviously indicates that you're not meeting the national standards, and that deficiency specifically represents a significant risk to the people using the services. So all of the findings are always brought back to focus on the resident and see, what does that mean to the resident, or what impact could that possibly have to them within the service. So again, that is their 4-level approach when they look at judgment descriptors. Now, there's a lot of information here, and we're going to break these down into each of the themes, and we're going to spend some time looking at the types of findings that were arising. But if we look at the 10 themes across the board, what does that information tell us? Well, first of all, I suppose it's important to bear in mind that the themes have different numbers of standard. Like you have contingency planning, which only has 1 standard, whereas you have the likes of accommodation that has 9 standards. So obviously there's going to be a lot more findings in that regard, but it does give us some kind of an indicator of where the key areas of concern are. And certainly from looking at this information just from a very superficial basis, we can see that theme 10 at 17 non-conformances, certainly getting a lot of focus, and there's significant issues there, followed then by theme 1 governance, and in coinciding with that is theme 2 in responsive workforce. So we have quite high levels of non-conformance. Funnily enough, if we look at contingency planning, as I said, there's only 1 standard in that, and no one achieved compliance in that regard, with 9 of them being fully non-compliant. Accommodation, we can see here, again, as I said, there's 9 standards there, so there's a lot of findings, but a lot of good work being done. If we have 23 being substantially compliant and 30 being compliant, there's obviously good work there, but with 9 and non-compliant and 11 substantially, there's obviously, again, activities required to ensure that we're bringing it up to a more compliant level. One of the ones that I would look at, and we'll get into it as we look at the individual themes, is theme 8, safeguarding and protection. So within theme 8, we have only 3 standards. So again, at 8 non-compliances and 16 partialities, that's quite a high level. And certainly if we're to learn anything from previous health and social care services under review and regulation by HIQA, it's a key area of concern. If we think back again, what I just talked about, the focus for HIQA are always about the risk to the resident, and they certainly see that safeguarding, if not managed properly and with the appropriate processes in place, it can have a significant risk to the residents within our services. So my suggestion is that we're going to just go through each one of these themes. We're going to look at the level of compliance against each of the standards within those, and then from that we're going to look at some of the specific findings under each of those themes. So the first one we're going to look at is theme 1, governance, accountability and leadership. And what I would say in relation to HIQA's approach, governance and management is very much seen as the bedrock to the strength of the overall organisation in relation to their ability to provide quality and safe care. We often say it is the element that provides the warm, fuzzy feeling. They feel that if the governance framework and structures are correct, then that will support the service provision throughout the organisation. But if we look at these and break it down, so as I said, there's 5 standards there in governance. What are we looking at? Well, the biggest one for non-compliance was actually in relation to monitoring, where they're requiring organisations and the senior management team to really be able to have oversight on the services being provided. And they felt that obviously with 6 non-compliances and 5 partialities, that there was significant concerns in that regard. But at the same level, standard 1 legal requirements, just the general understanding of the roles and responsibilities that are required of services, was also at 11 with non-compliant and partially combined. So significant concerns in relation to those. Standard 2 governance, relating more to the governance framework, the teams, committees, the roles and responsibilities allocation, 3 non-compliances and 6 partially in that regard. Charters, I suppose you either get it all right or you don't get it right at all, but some level of compliant and non-compliant areas. And standard 5, involvement, not quite as much activity in that regard. So we're going to take a little bit of time now just to drill down and see the types of non-conformances that were coming out under Theme 1. So first of all, the service provider had a limited understanding of their responsibilities under the national standard. So that's obviously under Standard 1, really having an understanding of the regulatory requirements that are there and the practical application of those responsibilities within the service. Another one, there was no developed governance, accountability and oversight systems to ensure that service delivery was safe and effective and meeting the requirements of those national standards. So they could not see that there was an oversight model that was actually going to draw information out of the service and that could be utilised to drive improvements in that regard. So there was no watchful eye on the provisions. There was limited involvement in the centre by the provider. For example, there were no records of meetings with the service provider and staff felt unsupported in their role. So again, that rolls back to understanding our legal requirements from the senior management perspective and being able to be on the ground, proactive and engaging with staff and hearing their concerns in that regard and supporting them to be able to provide care and support on the front line. There was an absence of operational policies and procedures, which is essential for the delivery of services to guide staff in delivering supports to residents. So I know that this is an ongoing process. Many of you have policies and procedures in place. Others, it's going through a process of development as you work your way through your journey of compliance, but really needs your policies and procedures are again that's your structure, and framework that's going to hold up your service provision. And it's really important that they incorporate not just the regulatory requirements, but the evidence-based best practice. The national policies need to be incorporated and considered. There's a lot in relation to that, and also not just having good policies and procedures, but how are they being implemented, rolled out? How is training being done on that to ensure that the processes implemented on a day-to-day basis are reflective of those policies and procedures? We don't want them in a folder gathering dust. We want them actually to be live documents that are implemented within the service. They found the service provider could not effectively self-identify risks, hazards, and areas that required improvement. So again, linking to that oversight, but where there's a self-identification of risks, and that linked to our contingency planning team, and that wasn't being effectively implemented. There was an absence of quality assurance systems. So again, this is relating to that monitoring requirement to ensure the best outcomes for residents. So they hadn't completed their annual review, and that an audit framework had not been put into practice at the time of inspection. The audit framework is just so critical to our monitoring processes and for all health and social care services. It cannot just be a tick box exercise. They are expecting to see effective, thorough, robust inspections on an ongoing basis throughout the service, and then utilising that information again to drive improvements within the service. So that really is critical to that monitoring, monitoring activity. Excuse me. In some facilities, there was no residence charter at the time of inspection. They found that in another case, there was poor management systems to uphold the rights of residents. And as a result, some residents felt unsafe living in the centre. So again, the rights of residents being at the forefront, and that responsibility very much being given to the senior management, that they have to drive that culture of respect for resident rights and keeping that central to the service, that it's not just something that is to maybe the frontline staff. It is a culture and it requires leadership to ensure that it's implemented. The provider did not have a clear understanding of the experience of all adults living in the centre. Consultation with residents regarding service provision or their experience was not prioritised. So again, we've seen this in residential care, where the resident feedback has become really, really central to the inspection process, and ensuring that their voices are heard within the service, that we're not just rolling out a service that we think is best, but utilising the feedback and experience that our residents have to ensure that they have the best possible provision in that regard. While there was a complaints procedure in place, there was no formal documentary evidence of complaints made or how they were being investigated and managed by the service provider. So again, if it's not written down, it didn't happen. But And in many cases, complaints are being managed on the front line, and a lot of good work being done on it. But we really need to be able to collate that information and utilize it to be able to identify trends and potential concerns within the service. Residents said they avoided raising issues or stopped giving feedback as they did not think it was being taken on board. So again, not allowing that voice of the resident being heard, and then taking the information that they provide to us and doing something about it. So understandably, if the residents don't feel that they're being heard, they're less likely to come forward with suggestions. So that's our theme one. We'll move on now to responsive workforce. We generally, when HIQA are out, they will go hand in hand with your governance and your responsive workforce. So in this case, we have 4 standards, and by a country mile, we can see that recruitment is the forerunner in relation to the non-compliance levels. We have some areas of focus in relation to supervision, and then in relation to the mandatory training requirements, we can see very little activity in relation to competency assessment. We'll look some at the specifics in relation to theme 2. So the inspectors found that the recruitment practice of the service provider were not safe or effective. There were no Garda vetting checks completed for some staff, or were there written references for others. So certainly Garda vetting, if we do an overview of the reports to date, then Garda vetting certainly was a hotspot. There was no formal recorded supervision arrangements in place to oversee and support staff within their roles. The provider had not undertaken a training needs analysis for staff, so there was no identification of potential weaknesses for a staff member, or additional upskilling that was required to ensure that they can provide the service that is required. The staff team did not have mandatory training in Children First or in the provision of person-centred care. So they see that very much as a mandatory requirement for the training. And a staff appraisal system had recently been developed, but had not been implemented at the time of inspection. So again, that is a requirement, that there is an ongoing review of the staff within the service, and ensuring again that there are training needs identified as part of that review. We look at theme 3 then, contingency planning, and that's an interesting one because there is only one standard in it, but nobody achieved compliance or even substantially compliant within this element. So although as I said, only one standard, it's very high level of non-compliance. So the types of issues that came up there was no risk management framework or policy in place. So there was no risk management policy, we had no risk register, possibly no risk management training in that regard. So that model of risk management was very much lacking. So within our risk management framework, we need to be considerate of the corporate risks, the service and care risks within the service, and then how are we addressing individual risks? And I suppose that links to our special reception needs. How are we linking that into our overall risk management framework? Excuse me, there was no risk analysis of the service completed to identify, assess, or control risks and hazards that may compromise the safety and well-being of residents. So that risk analysis, how are we really getting down and considering what are the direct risks to the residents within the service provision? The risk register in use in the centre was inadequate, and inspectors found numerous risks that had not been identified or assessed by the service provider. So a piecemeal effort to some degree maybe of a risk register, but that it wasn't again really sufficiently robust or thorough to identify the real risks in relation to the service. There were only 2 records of completed fire drills in the previous 5-year period. Multiple residents told inspectors that they had not been informed about evacuation plans in the event of an emergency. So emergency planning is really, really important. Again, HIQA has had a lot of focus on fire safety and emergency plans within other health and social care services. So it's only, it makes sense that they will have a lot of focus in this regard. So we need to ensure that we have that emergency plan in place that has clear evacuation process. Also really important that we consider any of the mobility issues or disabilities that our service providers might have, so that we have supports in place should an evacuation be required for those individuals. Accommodation then. So as I said, with accommodation, you have a lot of standards in here. So let's look at just the types and the level of activity that we have here. So standard 4.3, residence privacy and dignity, really is the one that has the most non-conformances linked with the overall planning of the accommodation services. We can see there's a lot of good areas like education facilities, laundry, security, non-food items, like a lot of good findings there, with just a scattering of non-conformances in that regard. So let's have a look at some of the detail as it relates to accommodation. So the service provider was using bunk beds to accommodate adult residents in rooms, although residents had not requested these beds. So that's a clear requirement within the national standards that that's not utilised unless requested. The floor space in bedrooms was limited, and there was a limited storage provided for residents. Inspectors observed mould in some rooms, and maintenance records showed that residents had regularly reported this. However, the provider had not implemented a comprehensive plan to solve the issue. So again, going back to actively working on feedback from residents and ensuring that their concerns are addressed. There was no policy to ensure a fair and transparent process was followed during accommodation allocation, and that it considered residents' needs and rights. So really, really important that we have that accommodation policy in place, and that has those considerations again relating to any information from IPAS that may have been received, and also from the initial assessments that are done on as residents come into the service, considering any special reception needs that might be there. The centre required a deep clean as well as a sustained and monitoring cleaning programme, and it is the responsibility of the centre manager, the provider, to ensure that that cleaning programme is implemented effectively and on an ongoing basis. Food, catering and cooking facilities, then we have two standards in that regard. So again, a number of quite good findings, compliant findings with that, with just one non-compliant and three partially. So let's have a look at some of the information coming from there. There was no option for residents to prepare their own meals if they wished to do so. In another, they found the kitchenettes provided did not have adequate facilities to allow residents to prepare their own food. The dining area in the facility had limited opening times, and residents did not have the permissions to access these facilities outside of these times. Many residents advised inspectors that they had sourced their own cooking equipment and fridges and had stored these in their rooms, as the catering facilities did not meet their needs. So obviously that was another consideration of the risks related to that alone, but obviously the needs were not being catered for within the facility in relation to catering. 6, then, person-centered care. This is an interesting one because all of the findings really are within standard 6.1, which is rights and diversity. So we've nothing under dignity, nothing under information processes, and just one compliant finding in privacy. So really all of the focus to date has been under that standard 6.1. So the types of information, there was evidence that complaints are poorly managed and that there was no learning from incidents or complaints. So complaints can sometimes come up both under theme 1, under governance, and also under theme 6. And your complaints policy is really, really so critical. It's one of the key indicators that that HIQA will look for. So again, taking the information from residents and utilising it to drive improvements. They really see that as a key indicator of your approach to your quality management system. Most of the residents who made complaints to the management team told inspectors that they were not happy with how they were handled or the outcomes of the investigation. Some residents spoken to were not aware of the complaints procedure or any information in relation to the external complaints remedies, and that is critical that you provide not only the information to your internal complaints process, but also the alternative external complaint remedies that are available to residents. Residents told inspectors that some staff members were openly biased and that there was favouritism displayed on occasion. So an area of concern. Theme 7, then, individual, family and community life. Again, a number of good compliant findings across the board. Nothing, no findings at all under standard 7.4 community initiatives, focus primarily being in relationships and public service access. So the types of findings there, There were a number of restrictions in place in relation to the receipt of visitors, and that did not have a clear rationale. So we need to have a very clear policy on that and communicate it accordingly. There was no clear arrangements in place to support residents to access services in the community. Residents had mixed levels of understanding as to the support they could seek from staff to help them avail of services in the community. A review of the transport arrangements in the centre was required to ensure that the residents' needs to access necessary services were being met. So we have a scattering of findings in relation to theme 7. Theme 8, safeguarding and protection. As I said, I really think this is a theme that will become under more and more scrutiny as HIQA move forward in the inspection process, particularly if you look at the high levels of partially compliant findings. So we have 7 non-compliance, 8 non-compliances, but really they're sending out the warning signal that work needs to be done on this pretty quickly if it's to be got under control and managed appropriately. So they found that there was limited awareness, again, of the responsibility of the provider and the staff to safeguard vulnerable adults in relation to the requirements of the national policy. And it's really important that that safeguarding training is completed across the board and that everybody is very aware of their roles and responsibilities in relation to that. There was an absence of learning from these incidents to prevent their reoccurrences. So again, taking that information and feeding it back down through the service. A number of residents informed inspectors that they were frustrated by the lack of follow-up in response to incidents involving conflict between the residents. So again, parallels to the complaints process in that regard. There was evidence that appropriate action had not been taken on some incidents which had occurred in the centre. So that response was not as required to address issues that were arising. Some residents said that they did not feel safe within the service, which is certainly not what we want to be the case. There was an absence of information on display in the centre on how residents could report adult safeguarding concerns. We need to have that communication available to residents to ensure that they know there is a process and a model to support them should they have any concerns. There was a limited recording of incidents or safeguarding concerns, as incidents were often managed informally and not recorded. So again, some good work being done, but it wasn't being documented to support formal analysis and trending. There were no risk assessments on incidents that had repeatedly occurred throughout the centre. So again, our risk management framework was falling down in that regard. So generally, if we have a robust risk management framework where an incident arises, that is then fed back into the risk management process. So we may have to look at additional controls being detailed within the risk register or whatever the case may be, but it's important that we have that linkage between the risk management framework and the incident management process. And there was no designated officer appointed to manage adult safeguarding concerns, which is a mandatory requirement. That individual is in place and is very aware of their roles and responsibilities in relation to safeguarding within the service. Moving to 9 then, which is health and well-being. We have 3 standards. Availability, didn't seem to get any activity in that regard, but generally a focus on the promotion of primarily of the services that are available to residents in relation to health and well-being. The types of findings: service had no records to demonstrate how they promoted the health, well-being and development of the residents. Again, work could be done, don't know, there was no records in that regard. While residents are provided with information on how to access the services, there was no records, again, to demonstrate how residents were supported on a day-to-day basis in relation to health promotion, physical and mental health or their welfare. And some residents said that the service had not supported them in relation to their medical conditions. So theme 10, we know that this is a particular area of focus. There is 5 standards in this regard, and we can see that, again, that standard 3, which is addressing the special reception needs, was by far the highest level of non-compliance, followed by the reception officer, and really the lack thereof, I suppose, of a dedicated reception officer under standard 10.4. We'll look at some of the specifics. The provider had not developed or implemented a policy to identify, communicate and address the special reception needs of residents. So we had no process, no defined structure to how that whole process is managed, initially from admission to monitoring to an ongoing process and communications in that regard. There was no system to record the supports and assessments completed by the reception officer with residents. In addition, the service needed to ensure there was a mechanism in place where the special reception needs of residents was monitored appropriately. And this is, that's a lot of requirements there. You need a system to record the supports, assessments that are being done, how you're going to monitor. There's a lot of activity there and a lot of requirements, and it's certainly going to need quite a robust process to be able to fulfill that in quite a challenging environment with the issues that many residents have, and even to be able to communicate their particular needs. There was no specialised training or support provided to staff in the centre to identify and respond to the special reception needs and the vulnerabilities of residents. And again, along with safeguarding, certainly training on identification and response to special reception needs is critical as part of that mandatory training requirements set up. The provider had not appointed a dedicated reception officer, or in another case, the reception officer also had a role of centre manager in another centre, which was their primary work base. And they, HIQA have identified that just won't work. You need to have a dedicated reception officer on site if that role is to be effective in their roles and responsibilities within the service. Some residents had additional vulnerabilities due to the nature of their accommodation and wider situations, but they did not have access to additional supports or services outside of what was available for residents. So it was a general application that there was no real consideration of the special reception needs of specific residents. There was no specific specialised training programme provided to staff on carrying out needs assessments and again responding to those special reception needs of residents. So that has been the whistle-stop tour over the 10 themes, looking particularly at the key areas of concern and focus. As I said, obviously those ones carrying the heavier load in relation to non-compliance being theme 10 that we've just looked at, theme 1, governance and responsive workforce. And, there are very significant trends that we have seen in that data, particularly, say, for governance. They're looking for a monitoring process to be put in place that will strengthen the overall governance model. For responsive workforce, the recruitment practices really, really need to align with the requirements to ensure the safety of the quality and safety of the service being provided. Theme 8, I would certainly flag up that's safeguarding and protection. We need a really robust process in place, and we have to be considerate of that national policy in relation to safeguarding of vulnerable individuals in relation to abuse. So it's not just about following the requirements within the standards. There's a much broader approach that is required of services. Contingency planning, 3, that being the risk management framework, really something that needs a lot of development time and consideration. That risk register is it's a significant piece of documentation, but it really does drive the consideration of what are the controls that we have in place to address those risks and what do we need to do further to ensure that those risks are addressed. But across the boards, I think there's learning for that. We have still quite a small pool of reports, and we're certainly going to be continuing to review the outcomes as they come through in those inspection reports. And we will continue to provide you with webinars to give you that information and feedback to ensure that you can focus your approach and your resources and your activities into the key areas of concern for HIQA. So with all of that in mind, how can HCI help? Well, if you have concerns in relation to some of the areas of your service provision, we complete gap analysis against the national standards, utilising the HIQA guidance document. So with our experience working in health and social care services, and with HIQA, we have a number of IPAS services that we work with currently. We utilise that to try and identify key areas of risk within your service and provide a report on that basis. We do have a full risk management programme that has the policy, the risk register and the risk management training process to ensure that you can really effectively put a robust risk management model in place. We do complete governance systems review and development, ensuring that governance model and framework and structure that they so require by HIQA to have your baseline and your framework in place, we can review that with you and certainly make sure that it's sufficiently robust and comprehensive. We complete education and training programs for all the mandatory training requirements for IPAS. One of the key features we complete is to develop an audit program for your service and complete those internal audits on your behalf to ensure that you have a really thorough, robust audit process, and that the audit reports are being utilised appropriately to drive continuous improvement within your service. And we're also involved in policy and procedure development to ensure that your processes are reflective not just of the requirements, but of evidence-based best practice and your services as they are implemented. So with all of that in mind, if you are interested in any of those supports, or if we can offer you any advice in that regard, please feel free to info us at that email address or that phone number, or I know Rosemary loves to get a call. So she's very open to discuss any of the services that we have available. So hopefully you found this of some use today. As I said, we hope to complete more of these webinars and just trying to share the information as we get it. And so hopefully you'll be able to utilize it on your journey going forward. Okay, and I'll leave it at that. Thank you very much for your time, everybody.